Hi everyone, Prandar Pau. I'm just going to wait another minute, just in case more people are going to join us. So welcome everybody. So we'll just give it till, I was going to say 16:02, but that's just ticked over. So maybe we'll make a start now. So welcome everybody. My name is Lisa Trigg. I'm the Director of Improvement and Development at Social Care Wales. It's wonderful to see so many of you here at this time on a Thursday afternoon. So thank you so much for joining us. This session is to launch the Positive Cultures Guide, which we've launched with our colleagues at Care Inspectorate Wales, and also to talk to you about some of the resources that you'll be able to find to support positive cultures. So pleased to see so many of you interested in this topic. Some of you will already be familiar with it. Some of you were involved with its creation. We worked with people across social care to develop the Positive Cultures Guide. So thank you to any of you on the call who were involved and gave up your valuable time to help us do that. And it's also an opportunity to hear from you about what supports positive cultures in your settings, what helps and what else is needed. So this is your chance to put in a bid for more support. So we've got a couple of housekeeping bits before we start. So today's webinar is through the medium of English. However, we will be uploading the webinar recording to our website with subtitles in Welsh. So if for those of you who are interested in that, that will be available after this webinar. As it's a webinar format, I know that many of us are new to this view of Teams, which is really a new experience for many of us. But because it's a webinar format, your camera and microphones will be off for the whole of the call. If you do have any questions throughout the session, feel free to pop them in the chat. We'll be keeping an eye on the chat and we'll have a Q&A section at the end. So please feel free to ask questions, to provide answers, or if there's anything else you need help with. I'm going to introduce our speakers. Each person will appear on the screen when they're talking. I won't get them all up now, but just so you know who's going to be joining us as speakers today. From Care Inspectorate Wales, we have Gillian Perrant, who's the Chief Inspector at Care Inspectorate Wales. We have her colleague Vicky Poole, the Strategic Support Lead at Care Inspectorate Wales, and Vicky's been a huge part of developing this piece of work. We've got Taryn Stevens here from Welsh Government, who's the Deputy Chief Social Care Officer, and also within Taryn's portfolio, she has the National Office for Care and Support, which hopefully many of you will have heard of now. And we also from Social Care Wales have my colleagues Jess Matthews and Beck Cicero, who are both Improvement and Development Managers. I'd also like to give a big shout out to Emma Davis, who's one of our I&D managers, but has been instrumental in pushing this piece of work through with Vicky at Care Inspectorate Wales. She's taken a back seat today, but she's really been the major driving force from Social Care Wales for this piece of work. So thank you, Emma. So many conversations, learning, research and evidence has helped us identify some principles which when brought together will support positive cultures in Wales. And that's really what the call is all about today. What we do know is there's already extraordinary practice across Wales. So this is not about trying to tell you about things that you don't do. It's just about trying to bring this all into one place, into a structured format that people might find helpful. So I just want to say that before we start. So Steph, can I bring up our agenda slide, if that's okay? Brilliant, thank you. So we have, as I said, a variety of speakers and we're going to be chopping and changing between each speaker. So bear with us, we have a very tight schedule, so we're going to be quite brutal with each other about cutting each other off. So apologies to anyone who gets chopped off at the with their time, but you can see we have a number of topics we want to get here, how we got here, who helped us, the wider context, and Taryn's going to give us some insight into that, why positive cultures matter and what the principles of it are, and then onto the practical stuff about who's this guide for, what resources are available and what the next steps are. And we'll also be having that Q&A I mentioned. So Steph, if we could go to the next slide. In a while after Gillian's spoken, I'm going to talk a little bit about the research and evidence we use to drive the Positive Cultures Guide. But at its heart, with all of the work that we've done, we've identified 5 principles of positive cultures, and systems and processes has been the enabler across the 5 principles. So they're 5-fold. It's a right-based approach which protects and promotes people's rights, recognises diversity, and ensures equality and protection from harm. It's about compassionate leaders who are authentic, visible, inclusive, who actively listen, who actively involve their people and teams in setting clear direction. Obviously, it's about supporting positive values and behaviours to guide relationships, how we work with people, whether it's the people that we're supporting or the people that we work alongside or the people that we're leading. Relationship-centred approaches that focus on people, but also on strengths rather than deficits. And a really big part of this is the continuous learning and development, and the importance of reflection. So not just about training, but also about learning on a day-to-day basis as part of encouraging innovation and encouraging service improvement. I'm going to just hand over to Gillian now. So I've said that we have worked together with Care Inspectorate Wales, and Gillian's going to say a bit about how we started on this journey. Thanks, Gillian.
Diolch, Lisa. Prynawn da pawb. I was delighted to see this resource published, and hope you're all going to find it really incredibly useful. The work was prompted by our learning from 2 key inquiries that we were involved in. We gave evidence to the Independent Inquiry into Child Sexual Abuse, ICSA, and one of the questions that had us really scratching our heads that we were asked is, how do you inspect culture? And you'll recall that uncovering the abuse of children in independent schools revealed toxic culture was quite a significant factor, and that included in schools here in Wales. The second inquiry was Operation Jasmine and the inquests that took place in 2021 into the tragic deaths of 7 people who died as a direct result of poor care. It was also informed by other tragic failings, such as Winterbourne Review, and lessons from child and adult practice reviews. So the learning from all of these showed clear links between organisational culture and outcomes for people, both those receiving care and support services and those working in them. We became aware that CQC had produced guidance about closed cultures and outcomes for people, but here in Wales, our legislation is predicated on a strengths-based approach. And so what we wanted to understand was, what does positive culture look like? And so this led to a lot of conversations between us and Social Care Wales, and this led to the development of this resource. It's for leaders, but at all levels working in social care in Wales. It's not only aimed at services registered with CIW, it's equally relevant for leaders in local authority social services, the third sector's organisations, and of course, Care Inspectorate Wales and Social Care Wales. But let me focus for a minute on registered services. Last year, there were amendments to the statutory guidance for RISCA to include greater reference to culture and the role of the RI in promoting positive culture. So Regulation 6 says service providers have clear arrangements for the oversight and governance of the service to establish, develop and embed a positive and compassionate culture, which ensures the best possible outcomes are achieved for individuals using the service. And those amendments were a direct result of this work. So we felt it was really important to provide resource that could help support you and organisations to develop and embed positive cultures. Little in this resource is new, except for the talking heads. And this is deliberate. As we know from the outset, there's so much information out there to support the development of a positive culture. And I'll leave Lisa to talk about the Sky research. But what was there existed in a myriad of places. And so what we set out to do was to develop a coherent framework that pulled the threads of both CIW and Social Care Wales work together, along with the work of partners who helped us along the way. And together we identified those 5 key principles, all of which must be supported by systems and processes that reflect and help deliver these. More about these in a moment, but now let me hand back to Lisa to talk about who's helped shape this resource.
Thank you, Gillian. So, Steph, if we can go to the next slide. So who helped us? Sorry, not the next slide. That's great. Back to the one before. So, an important step for us in this whole process when we started talking to Care Inspectorate Wales was to base our recommendations on a firm evidence base. So, you know, intuitively, positive cultures make sense. And nobody would, I think, argue with that. But we wanted to understand what research told us about positive cultures and what it means to put those in place. So we asked the Social Care Institute for Excellence. Some of you will know of Sky, so as I say, the Social Care Institute for Excellence. We asked them to look at what was already known about positive cultures. And when you have a look at the guide, you can see the link to that research to have a look at it in more detail if you'd like to. We asked them to look at programmes like My Home Life. So many of you who work in residential care may have heard of that. They looked at Progress for Providers, which our colleagues in North Wales have explored, but basically looked at programmes from across social care to see what type of things have been tried and tested and what's worked. So what they were able to do, one is that there was no one model of putting this wonderful practice in place, but they recognised that there were some key components of positive cultures. So one is having good leadership, one is focusing on promoting and upholding people's rights, one is values and behaviours, and also, but positive cultures require, and this is really important, every part of the system, including policy, including commissioners, including how we inspect services, including how we support services, how we work with our health partners. All of those different components need to work together if we're really to deliver what matters to people. So we took the research, and then what we did was invited key stakeholders to come together to really look at what we could do to shape the guide and what the findings meant for a positive culture in Wales. So we included representatives from Careforum Wales. So we had, providers were represented by Careforum Wales being involved. We had representation from ADSS Cymru, the Association Directors of Social Services. We had the Older People's Commissioner, the Children's Commissioner. We had people from Welsh Government and Taryn and her colleagues, and also from the National Commissioning Board. One of the things we would ask you today is that we would love many more people to be involved in continuing this programme of work and how we develop things. So please take the opportunity to send us your information if you're keen to get involved. And we also engage with organisations like Carers Wales and CLICE, so the people who are representing the voice of the public and patients and people who use care and support in health and social care. So we brought all of those together, and this is how we've moved towards developing and publishing this guide. Obviously, this comes in a much wider policy context. So I'm going to hand over to Taryn Stevens, who I introduced earlier. So Taryn is going to share how this fits into the wider picture. Thank you, Taryn.
Thanks, Lisa, and bore da pawb. I just wanted to start by saying it's fantastic to be here today and to see that so many people have joined today's webinar to talk about something that lies at the very heart of great social care, positive cultures. Because when we talk about positive cultures, we're really talking about people, how they feel, how they're treated, and how they're empowered to thrive. Systems and processes are an overarching theme of the positive cultures principles, which is why policy context is so important. The National Office for Care and Support was launched in April 2024. And as I talk through the work of the office, you will see that positive culture principles are a golden thread that run through the National Office's work. The National Office is here to support innovation, improvement and transformation, to support and enable delivery of national priorities and to provide strong national leadership and direction, to work closely with the sector, workforce and those who access services and to champion meaningful national changes. As a visual learner, I like to think of the National Office and the work of policy teams as the roots of a tree. It plays a vital role drawing together the elements needed to support the system to prepare for the future, drawing in learning to create system change and helping the branches of the tree grow stronger. Like any healthy tree, these roots create the conditions for social care to thrive. Embedding positive cultures is essential for the National Office to model the behaviours we want to see flourish and to support the right systems and processes to turn policy into practice. With those roots in mind, let's look at the National Office and how it nurtures positive cultures in practice. It does so in three powerful ways, primarily. Firstly, by giving the sector a strong voice. We're here to listen, to connect and to speak up for what matters, whether that's the experiences of people who draw on care and support or the insights of those who deliver it. By bringing together the voices from across the sector, we can help shape a shared vision for social care in Wales, one that's grounded in values, evidence and lived experience. Secondly, the National Office helps the system learn, grow and improve. Through our national oversight role, we shine a light on what good practice looks like, not just in policy, but in practice. We amplify the voices of people with lived experience and support organisations to reflect, adapt and innovate. One example is the development of the National Commissioning Framework, which is a statutory code of practice introduced in September 2024, so still relatively new. It was created in partnership with people who draw on care and support, providers, commissioners and other key stakeholders. It sets out a shared approach to commissioning that is ethical, outcomes focused and person-centred. It's not just a technical document, it's a real tool for culture change and it helps local authorities and health commission services in a way that reflects the values we want to see across the system. Dignity, voice, choice and control. And it supports a more consistent, equitable experience of care across Wales. Thirdly, the National Office shapes systems and processes that allow positive cultures to thrive and deliver change. That means creating the right conditions, structures, standards and supports that make it easy for value-led practice to flourish. When culture and systems align, lasting change flows. One of the key branches of the National Office work is our focus on workforce and social partnership. Social partnership working with the sector is central to everything that we do. Through the Social Care Fair Work Forum and its expansive membership, importantly including unions, we're working to improve pay, terms and conditions for our social care workers. The forum is leading a number of programmes of work, including Workers' Voice Task and Finish Group. We know that workplaces which promote fair work, fair pay and good terms and conditions and where staff feel heard and supported create the conditions for positive cultures to thrive. And when staff are well supported and motivated, that translates directly into better outcomes for people and those that they care for. We believe that fair work and positive cultures are inseparable. A well supported, motivated workforce delivers better care. Because what matters most is ensuring a social care system that is safe and effective, but also kind, empowering and deeply human. This is why the work undertaken by the Care Inspectorate Wales and Social Care Wales on positive cultures supports clear principles for our work across the sector And I hope some of the examples that I've touched upon describe the National Office's work and role in that. So I'll hand over to Gillian, who's going to speak a little bit more about why positive cultures matter.
That's great. Thank you, Taryn. So from the perspective then of the inspectorate and the regulator, why does positive culture matter? What do we find in the best of services, those delivering positive outcomes for people with well-supported staff? Well, we consistently find compassionate leaders with a relentless focus on continuous improvement. Where the leadership and management of a service are good or excellent, the outcomes for people receiving those services are always very positive. And conversely, in terms of regulated services, the areas we most frequently identify as needing improvement are leadership and management. I spoke earlier about what led to the development of this work, but a key benefit in developing a positive culture is that it helps improve the quality of care provided to people. So a positive culture can support people to achieve what matters to them. It can improve people's well-being, both people who access services and the people who work in them. It can help with recruitment and retention. If staff feel happier at work, they want to work there longer, and you gain and we gain a reputation as a really attractive place to be. It helps staff feel supported and capable of doing their very best work, even when things are challenging. It helps to improve services by learning from and working with other organisations and partners and the people that you support. It also helps to be clear about your purpose and the things you need to focus on. We've just heard from Taryn that this resource and its principles don't and can't exist in isolation. And at the moment in CIW, we're working actively with stakeholders to review the guidance on quality of care reviews prepared by the services registered with us. This is very much part of RISCA's focus on quality. And remember, RISCA was informed by the lessons from Operation Jasmine. The statutory guidance has over 50 references to quality. Having a positive culture and being able to assess and evidence this in a way, it's a way for providers and responsible individuals and managers to continuously improve and strive for excellence. Our new descriptors for ratings, aligned to our lines of inquiry, reference culture 35 times and specific reference to positive cultures 7 times in those descriptors for good and excellence. The framework as a whole reflects each of the principles that I've just run through. When we provide feedback at the end of an inspection, whether that's of a regulated service or a local authority, we will be reflecting what we find in terms of the culture of that organisation. Of course, we already do this, but we've not had this framework to give it the type of tight framework that will help shape this better going forward. So let's hear now a little more about the principles from Vicky and Beth and Jess and Taryn.
Thank you, Gillian. Pranam Dar, everybody. I'm going to quickly run through the principles. This isn't in the principles are in no order of priority at all. They're all equally important. So that's really important to say from the outset. And I think just to start, when I was reflecting about the principles, was talking about them from a person-centered perspective. So the first one we're going to talk about is right. So positive cultures protect, promote and support people's rights. So if I was a person receiving a domiciliary support service, put myself in the shoes of a person receiving a service, and this is from an organisation that's got a rights-based approach embedded in all aspects of its work. For me, this means that my lived experience is listened to, but more than that, I have choice and control. I have a say in the decisions that affect me. And my partner is also listened to as a partner in my care. And when I was recently at the risk of financial abuse by a neighbour, my care workers recognised this and helped to keep me safe, all about promoting and protecting my rights. Then moving myself into the role of a member of staff working for a domiciliary support service, I really feel in an organisation with a positive culture that diversity is respected and promoted. All of my team really have a say in the way we do things at work. And if I need any support, a manager is always on hand to listen to me. And I feel confident to be able to say if something goes wrong because I trust them to help me sort it out. I know a really important part of my job is to promote the rights of the people I support. And because our managers do this for all of us in the team, it makes it much easier to understand how I then do this for the people I support. So now I'm going to hand over to Beck to talk about the next principle.
Thank you, Vicky. And the next principle is around leadership, and positive cultures have compassionate leaders. Compassionate leadership, what do we mean by that? Is based around 4 key behaviours. And these are, firstly, attending. So that means being present with those that we lead, listening to our staff with attention and with fascination. The second behaviour is understanding, and that's dependent on listening deeply, active listening, the thing that we do day to day with the people that we provide care and support to, and reflecting that back in the ways in which we support our own staff as well. It's about taking the time to really listen in order to understand the challenges that those that we lead face in their work. The next behaviour is empathising, and that's about feeling the strains, the pains, the anxieties and frustrations of those that we lead, but without being overwhelmed by those feelings. And that's what gives us that motivation to help or serve our workforce. And the fourth behaviour is is helping. So that is really about ensuring there's that good path for those that we lead to achieve their goals. So helping them by removing those obstacles, providing the resources and support they need to help them to deliver high quality care. And why does it matter? Well, compassionate leadership matters because evidence shows that it helps create those workplaces that can work together to reach the same goal, that can learn honestly from mistakes at work, that creates workplaces where people are motivated to do a good job, and that feel comfortable and safe raising issues that help to improve things and make things better for the service. It also is shown to attract people with similar values to new roles. It helps to retain staff within an organisation, and most importantly, it's workplaces where we're compassionate to each other. And compassionate leadership isn't about sort of shying away from the difficult issues. It's about creating that culture of open and honest ways of working, and actually taking action against the difficult issues, but in ways that help staff to feel safe and supported. So I'll hand you back now to Vicky, who will be explaining why values and behaviours matter.
I mean, it probably goes without saying why values and behaviours matter. I mean, values are the way that we do things around here, and they're the things that we think are important. They guide our actions and our decisions and how we behave in relation to those. There's something that we often feel strongly about without knowing why, and I think as a social care sector we've got a shared set of values and beliefs. It's about putting the code of professional practice that Social Care Wales produce into practice, and as leaders we all need to model our organisation's values. They shouldn't just be something that's sat on a poster, sat on the wall. We need to walk the walk, in essence, as leaders in social care. And it's about being really clear about what good looks like, what behaviours should people expect? Should people working for you and people drawing on care and support expect? And knowing when people aren't working in line with values and be able to say something about that. And many organisations now approach recruitment from the point of view of values, which allows you to look beyond traditional qualifications and find people who might not have any prior experience in social care, but actually possess exactly the values and behaviours that we want to encourage and grow. And like Beck said about compassionate leadership, it also supports the recruitment and retention of staff. And for people accessing services, it means they can be confident that the people that are providing care and support, be it social workers or care workers, will act in line with the other principles that we're talking about today. So now I'm going to hand over to Jeff.
Thank you, Vicky. Prynhawn da, everybody. I'm going to talk to you about relationship-based approaches. Working in this way, in a relationship-based approach, is a way of working where we explore in a collaborative way somebody's strengths, their abilities and their circumstances, rather than focusing on what they can't do. This approach is underpinned by strengths-based practice, can be used at any time to support children and adults, but should also be at the very heart of the way we work within our organisation and with partners. Working together, we develop a shared understanding of what matters and what needs to happen to help the people we care for live the best life possible, focusing on their overall well-being. To do this, we agree goals, which we call personal outcomes. We use these to make a plan which builds on what the person can do, their family, their friends, and their community networks. We can also talk about what we're worried about, risks, and work together to make sure that the plan helps us manage any ups and downs, keeping everyone safe where possible. So why does this matter? Focusing on relationships and the strengths of individuals, our workforce and organisation means that everyone gets to realise their full potential, confidence and abilities, becomes motivated and engaged with people and activities leading to growth and better well-being across the board, supports collaboration, trust, partnership working leading to shared learning, decision-making and management of informed risks. All of this ensures everyone has a role and is part of leading and developing positive cultures. I'm now going to hand back to Vicky, who's going to tell us about the importance of continuous learning and improvement.
Thanks, Jess. We were clear from the outset when we were doing this work and developing this resource that positive cultures, we don't want it to be seen or used as a performance management tool. It's something that's there to support. And it's recognising the importance of continuous improvement informed by self-evaluation and reflective practice that's an essential element of developing and maintaining a positive culture. Continuous improvement is not necessarily about putting things right when they've gone wrong, although obviously it can be, but it is about using the strengths-based approach that Jess has just talked about to build on what is good. And it's not a one-off event, so it's not just not just doing your quality of care review. It's not just doing your annual director's report or our annual report in CIW. It's something that you do as an ongoing process to identify opportunities and make incremental changes that should be improving the lives of the people who are drawing on care and support in Wales. How do you know if the culture of your service is positive? What's working well and what could improve? Those are the sorts of questions that we think underneath this principle are the sorts of things that we should all be asking ourselves as leaders. And are we looking outside of our service to see what others are doing well? And what is the evidence saying about what works? And of course, commitment to learning and development for staff is an essential component of this principle. But as with all the principles, this doesn't stand alone. They're all inextricably linked. So I'm just going to hand over to Taryn now to talk about that underpinning principle.
Thanks very much, Vicky. So as I shared earlier and as Lisa has highlighted, systems and processes are a cross-cutting theme across the principles. So what does this mean and why is it a cross-cutting theme? I always think of systems and processes as the vehicle for change, while culture is what gets everybody on the bus, shapes the journey and defines the destination. culture without the structure and the consistency of systems and processes, risk losing direction, and systems without culture, lack of heart and purpose needed to inspire meaningful change. A clear example of this in practice is the National Commissioning Framework I referred to earlier, where local authorities and health boards are expected to commission services to not only meet care needs, but also to promote positive organisational culture. This means embedding dignity, co-production and staff wellbeing directly into service specifications and contracts. In my experiences as a child protection social worker, head of service and policy maker, it's about applying the positive culture principles as part of any system in our processes, engaging with people who have lived experience and practice experience, holding meaningful conversations, co-producing solutions and modelling the behaviours we want to see as leaders. Systems and processes also need to focus on collecting data and monitoring the impact of change so we can continuously improve and learn. When systems are aligned with culture and when leadership creates space for challenge and innovation, we build a Wales where policy and practice truly deliver for people. This is why it's important that systems and processes are a key principle within the Supporting Positive Cultures Guide. I'm just going to hand over to Gillian, who's going to speak a little bit more about who the Positive Cultures Guide is for.
Thanks, Maria. I think it's an easy answer to this. The guide is for all managers and leaders social care. And what I do know is that you can be a leader without having a formal status or a job title. I'm confident can help, because it can help in planning, it can help in delivering, and it can help in improving at a local, regional and national level. And so that includes leaders and managers in social care services, including third sector organisations and user-led organisations, health boards, local authority commissioners, Welsh Government policy leads, and of course, Kent and Social Care Wales. And that basically is all of us on the call today. The most important thing and the responsibility for all of us is that this isn't just a document and a launch event that we think, well, that was very interesting, but we need to use it and not let it just gather dust on a shelf. Lisa, I'm conscious there's lots of resources for this, and I think you're going to share some of that with us now.
Certainly am. Thanks, Gillian. Steph, can I go to the next slide, which is where we show people what's available? So there is quite a bit of support available. We developed an overarching guide, and you can find it in both a PDF format. So if you want to print it, that's easily done. There's a website with the full guide in website format, and also some really nice talking head videos. So we're really grateful to the people who made the time to do those videos, and you can find those on the website or in the links in the PDF version. So hopefully you've already seen it. We've already had, I think 700 people have downloaded it. So I'm sure there are people on this call who've done that. It's just a toe in the water though, and we're really keen to know what else might be useful. We'll be doing a whole bunch of things to develop these further, but we're really keen to hear from you. One thing we are going to do is develop an animation for people who use care and support, who access care and support, so they understand what to expect and what positive cultures means. So we're working on that one. So those are where the resources are. I'll put the link to the website in the chat so you can have a look after this call. Steph, if you could go to the next slide. So we're also, oh, sorry, Steph, if you go back one. Oh, sorry, I thought that there was another slide. Sorry, my bad. So before we open up to a Q&A, so these are the resources that are already available, but there's lots of work now going on in the background to develop further resources and further work. So our colleagues, Gillian and Vicky and their teams are working on how we review the quality of care, but also development of a self-assessment tool so that provides, well, anyone on this call in any organisation providing care in Wales can assess where they are on this journey. And we'll build, you know, what we're trying to do is build positive cultures into all of the work that we do. I think we have someone, I think we have Holly Bain on the call. I hope you're here. Hello, if you are, Holly, who's here from the RAIN Foundation, which is an organisation who have funded some extra work for us. So over the next 2 or 3 years, Holly and the RAIN Foundation will be helping us do more on positive cultures, and specifically to understand what you would like to support your positive cultures work, but also to test positive cultures and how we might support positive cultures in more, more deeply and more closely with you. So we'll be using some of that funding to run some pilots, and we'll also be using evaluation to really understand what types of support would work best. So we're very keen to have your feedback, to hear if you'd like to get involved, to hear if you would like to know more about those programmes. And a really key part of that, we'll be having lots of sessions like this to make sure that we share learning across Wales. So if you're not directly involved, we hope that we plan to have lots of opportunities for you to join these sorts of events or to hear about what we're learning. So please do have a look at those resources, and I'm going to hand back to Gillian, I think, who's going to take us through a bit of a Q&A to see, to really get a sense of what you're thinking about these resources and what we do next. Thanks, everyone.